righty. I want to thank everyone for joining us this evening. Happy Monday. That's where we are right now. So I hope you guys are excited. We are excited here at Silence to Shame because yesterday we celebrated Black Children's Mental Health Awareness Day here in Georgia. And again, we got legislative support in order to designate this day specifically so that we can bring attention to the rising rates of suicide. Again, my name is Jewel Gooding, and I am the Executive Director here at Silence to Shame. And I want to welcome you all to our Black Children's Mental Health Awareness Day Town Hall. We have an amazing lineup of guests who are ready to dig in deep and talk about some of the statistics and the data behind the rising rates of suicide among our Black youth, but more importantly, to offer some thoughtful solutions as we continue to prioritize all of our youth and making sure they can get the support that they need. So just a few housekeeping tips. Just want you guys to know about our chat function. If you have any questions, please feel free to throw those in the chat. You can also utilize our Q&A function if you have a question for any of our panelists. We can ask those questions either directly online or we will answer them live as well. At the end of this event, I want to just remind you guys that we do have an evaluation, so you all can just tell us how you think and what we did. That will also give you access to just a certificate for your attendance as well. So we really appreciate your time on today. So at this time, I want to introduce our founder and our Chief Executive Officer, Miss Beautiful Shanti Das. She is going to get you all pumped for this evening, and we are going to just dive right into this conversation. So Shanti, I will kick it to you.
Thank you so much, Jewel. Welcome, welcome, welcome. Good evening. I bring you greetings from New York City in my wonderful hotel room here. I am so excited. It is May, everybody. The little green heart. It is Mental Health Awareness Month. And as Jewel said, we're so excited to have you all here. Again, I am the CEO and founder of Silence to Shame, and we're excited to come together this evening for this very special and really important community conversation. Again, we celebrated May 1st yesterday as the first Black Children's Mental Health Awareness Day in the state of Georgia. And I have to give our incredible executive director, Jewel Gooding, again, shout outs for that, for making that come to fruition for our organization. And so Silence to Shame observes this day in a variety of ways, including increasing awareness of risk factors and challenges unique to the Black youth to reduce stigma surrounding suicide and mental illness, offering prevention and intervention strategies to support healthier outcomes. So we are here tonight to engage in a discussion with a fantastic group of experts to better understand the growing risk factors and social determinants that exacerbate the mental health of Black children in Georgia, as well as other states, and provide resources and intervention strategies to the community for ways to support our Black youth and their mental health. So without further ado, I'd love to bring on our panelists, and I would like to start with my good friend and a friend of Silence to Shame, Dr. Laroy Reese. You're on mute, Dr. Reese. Can't hear you, my brother. There you go.
I had everything together except being not on mute. So good evening. It's a pleasure to be with you, Shanti, in Silence to Shame. As always, I'm honored by the opportunity to both offer some pieces of my experience, but also to learn both from the other panelists and from the colleagues in the audience. But as to who I am, my name is Rory Reese. I'm an associate professor of psychiatry and behavioral sciences and community health and preventive medicine at Morehouse School of Medicine. In addition, I'm director of behavioral health at Coleman Counseling and Consulting. It's an outpatient practice here in Atlanta. Clinically, I work with primarily a pediatric patient census, but I particularly work with young African-American males, adolescent males in particular. I've been doing that work for a while. I'm excited to be part of this conversation. This is, you know, as I think about how we do better as community, we start with our kids. So I really appreciate the opportunity to be here this evening. Thank you.
Thank you, Dr. Reese. Next, let's go to Trebor Randall. Welcome, Trebor.
Hi, good evening, and thank you for having me. I so much appreciate the invitation. I've known Jewel for a long time. She's been working in this space, and she's probably the only person that I know that's more of a fanatic about saving children than I am. So I was very glad to be a part of Silence the Shame. So as you mentioned, my name is Trebor Randall. I am what I call newly retired or rewired after 30 years in law enforcement. And that's where my experience comes from working in this space, from investigating child deaths and child fatalities, and more importantly, how we prevent that. So 30 years law enforcement, the last 7 years, 27 years working with the GBI as a special agent, and the last 7 years specifically working, overseeing the work of the Child Fatality Review Unit statewide, and reviewing cases throughout 159 counties of deaths in children ages 0 to 17, which often included those deaths by suicide, anywhere from 40, 50 to 60 cases a year. We all know that one is too many. So that's where my experience comes from learning from those investigations, where we may have failed, what we could do differently, and just working in that space of prevention. And I think it's so important that you are having this conversation about that stigma, that shame when it comes to our children of color as it relates to suicide. So I'm looking forward to having that conversation and hopefully answering some questions that anyone might have related to that.
Awesome. Thank you so much. And thank you for your work that you've done in our community. Next, let's go to Brandon Johnson. Hi, Brandon.
Hey, good evening, everyone. I'm Brandon Johnson. I'm representing the ACOMA project, which is based here in DC, Northern Virginia. I am greeting you all today from Baltimore, Maryland, where my home is. And so the ACOMA project is specifically dedicated to raising the awareness of mental health issues for our young Black youth. And so we do this by raising consciousness, providing resources, connecting young people to therapy, and also engaging with their caregivers to stress the importance of mental health, signs and symptoms, and to really create mental health advocates, even from our young people. So I serve as a subject matter expert with ACOMA, and personally, I've been in the suicide prevention field for the last 9 years. I've worked local, state, and federally on suicide prevention, particularly around suicide prevention among Black youth. And so I'm super excited for this conversation and honored to be a part of it tonight.
Thank you, thank you, thank you. And send my best to Dr. Alfie. We appreciate the work you do. Next, let's go to Takesha Lewis, who's a friend of the organization from Jack and Jill of America Incorporated.
Good evening. Thank you, Shanti, for having me this evening. My name again is Takesha Lewis, and I am excited to be here. I serve as the foundation member at large for the Southeastern region of Jack and Jill of America Incorporated, where I'm charged with overseeing all of our regional fundraising and community service efforts, and serving as a member of the Jack and Jill of America Foundation Board. And I also have the honor of serving as our Regional Executive Board Liaison for our partnership with Silence the Shame. And I'm so excited to be here and to serve in that capacity. I am a social worker by profession with over 20 years of experience in an array of social services programs, working with youth and families during some of the most vulnerable times in their lives. And I'm currently working with K-12 education in the Macon-Bibb County area. So I have worked in this community and seen how mental health has gone through our community, through our African American, not only our adults, but in our children. So this conversation is so important for us to have. But I just have the pleasure of serving on many boards in the community, which are all dedicated to eliminating barriers and supporting families and reaching their full potential. So I'm excited to join the conversation tonight as we continue to educate our community and uplifting families and all children to be able to thrive to the best of their ability. So thank you so much again for having me this evening.
Thank you. And again, we appreciate you and all the work that you do. Last and certainly not least, we'd like to welcome Ms. Brittany Newton, who is from Voices for Georgia's Children. Hi, Brittany.
Good evening, everyone. I too am so excited to be here today. I'm a senior policy analyst with Voices for Georgia's Children, which is a statewide whole child policy and advocacy organization. And so my work primarily centers on increasing access to health and behavioral health services. So very happy to be here and a part of the conversation tonight.
Awesome, awesome. Again, for those of you that are just logging on, welcome to Silence to Shame Black Children's Mental Health Awareness Day Town Hall. So we're going to jump right in. I'd like to start with Trebor. What would you identify as the biggest challenges that exacerbate the mental health of Black youth, in your opinion?
Well, again, working from a space of child fatality and looking at the end result and then going backwards from there, after we determine cause and manner of death, and we know that these cases are clearly going to be suicide related. And then to give you a little context, law enforcement in general, I guess because I'm a law enforcement officer, so I would like to speak from that space to also encourage our law enforcement agencies to think a little bit out of the box. Typically, our job is to come in and do a death investigation. And whether that's a local law enforcement agency that responds to the home, to the family where this has occurred, or they respond to the hospital, their job is to determine what's happened. How did this happen? And do we need any continued investigation? Was this caused by another individual? Well, a lot of times with suicides, what happens is they come in, they're able to determine either by way of, the circumstances surrounding the investigation, whether there was an outcry of a particular child, whether that child had been previously treated for mental health issues, whether that child had previous attempts. They're going to make a determination as best they can based on all of those factors. And then that investigation is closed. So it's up to those advocates, the single state agencies, whether DFACS was involved, the schools should certainly be involved to try and go backwards and determine, well, how did we get here? One of the biggest challenges is a lack of further investigation. I'll start there because I can pick on us because I'm, a 30-year law enforcement veteran, that we have a tendency, like I said, to close that file. If DFACS isn't already involved with that family or that child, there may not be a referral, okay, for someone to say, what's going on in that home, what was going on in that child's life, and are there other siblings now who are going to be at higher risk because of what has happened, right, in the home? That file oftentimes is closed. Another challenge is the schools. One of the things that I found out when I came into this space, and I was saying, well, we've got these alarming numbers of suicides happening. Again, kids up to ages 17, right before their 18th birthday, is the area that I had jurisdiction over. So my first thought is, we can reach a vast amount of youth if we go to the schools, either before this has occurred, but definitely after, and talk to the kids. The cat's out of the bag, right? I've been told, well, schools are, they're kind of nervous about this. Some schools, they're not all created differently because we don't want to plant that seed to other kids about suicide. But what I have come to learn working in this space is that the other kids that were exposed to that youth, whether they were friends or whether they just knew of the student, whether they played on a basketball or football team together, had some of the same classes together, the kids oftentimes know more than the adults. They know what's going on. They knew the challenges that the child may have been having. They're more likely going to talk to their friends than they are another adult. I think it's important that we engage with the youth. And then I found out that we have 159 silos. And what I mean by that is no two schools are created equally in terms of their comfort level, as far as letting experts come in and have access to all of the students. It used to bother me whenever there would be a tragedy of a child at a high school or middle school, and then you would hear in the media that, we're going to have grief counselors on hand. Should a child need to talk to somebody, they will be available. And I have found out that if we're putting our heads in the sand, if we're waiting for these kids to come and knock on somebody's door. But what I have found is that every school is at a different level. There's no statewide necessary requirement for how they are to handle suicide prevention in their school. That's also a barrier. And then lastly, what you guys are talking about now when it comes to my Black children who have committed suicide, who have made suicidal attempts or voiced suicidal ideations. I can tell you based on investigation, based on fact, looking at that child's life, peeling back the layers, looking at the file, that we don't have the follow-up or the follow-through that you may see in other children. You know, one of my charts that I was looking at in preparation for you all tonight, you know, we categorize at the state level, we categorize the children as Black, non-Hispanic, white, and other. And I can tell you that the majority of the time when I was dealing with a Black youth, there was no follow-through, the appropriate level of follow-through if that child had an outcry or if that child had made a previous attempt. Some of that is due to just our families, you know, and how you know, our families, what our beliefs are, you know, whether we should go to, you know, a religious leader when we have issues, mental health issues, not necessarily referring the child to a pediatrician or a counselor. That is one of the things I noticed as well. So those are just three of the barriers. But the largest barriers, in my opinion, that I have seen when it comes to addressing this issue, when it comes to children of color and then children in general.
Thank you so much. I would like to hear from Takesha next in the school system.
As it relates to this question in particular, and the role of the schools, there are, Trebor is absolutely correct. No two schools are the same. So that has been an identified barrier for providing some services in some schools. I will say though, I think that schools are in a position now to where the need is definitely increasing. And there have been, you know, some changes and some openness to receiving those mental health services, whether it be through the school or through some outside resources in the community. I know in every community is different. So my community is much smaller than the Atlanta metro area. So even the accessibility to services is on a different scale. However, our rates of suicide are definitely increasing here in our community. We have had this school year alone about 5. All have been African Americans, and this is something completely different for us. However, we are able to partner with local community organizations to provide mental health services to our students, even in school. One of the barriers that we oftentimes see, and it goes along with the need for these conversations, is just the lack of education in our community and being able to promote and receive that consent from our parents who may be not as receptive to the services. So I do think that it is twofold. The school systems are definitely open. There are definitely programs available now within our schools and also within our communities. I think that it is so important for us to continue these conversations and to educate our parents so that they will be more receptive to their children receiving the services, and also educating our students so that they would be more receptive to the services as well. But I definitely think that we are in a space to where that conversation is changing and that those services are definitely becoming more prevalent in the schools, because the schools always want to make sure that, one, our children are safe and that they are healthy mind, body, and spirit. So because it definitely impacts their academic performance.
Thank you. So much great information from you and Trebor, and, you know, so many barriers to care, right? So many reasons that the mental health of our Black children, you know, is in fact exacerbated. But we are starting to normalize this conversation. And that's why, again, you know, we're grateful that the resolution was written for us, designating May 1st as Black Children's Mental Health Day, but so much more to be done. I want to go to you next, Dr. Reese. Can you talk about adverse child experiences, otherwise known as ACE, and how these experiences can interfere with a person's health, stability, and opportunities?
Sure. So adverse childhood experiences are negative or traumatic experiences that happen throughout the course of a child's childhood or adolescence. And some examples of that can include witnessing violence. And that violence can be seeing somebody stabbed, shot, fought, or knowing somebody who completed a suicide. It can also include young people who've been exposed to or experienced physical, emotional, or sexual abuse or neglect. But those are other examples. Additional examples include things like being abandoned by a parent. So those kids who are growing up without a relationship with one parent or with both parents are kids who are experiencing an adverse event. Now, the thing about adverse childhood experiences is that if development is supposed to go like this, that what the adverse childhood experience does is it throws some curves in there, right? And that in of itself is not necessarily a problem, because all of us, everybody, all the panelists, all the people in the audience have had things happen in their life. Where it really becomes something that we have to be concerned with in terms of kind of altering what happens as we get to the end of our development is if there's no course correction. So the person who saw somebody murdered or knew somebody who completed a homicide, but who doesn't get counseling to kind of help them understand that and to resolve the trauma of that experience. The person who's abandoned by their parents or somehow experiences some type of neglect or abuse, but doesn't get some support or intervention to kind of help them make sense out of that experience. And here's the real danger. The real danger when these adverse childhood experiences are, there isn't a course correction for that, is that the young person begins to think that this is normal, that it is normal for people to fight and shoot, that it is normal for people to commit suicide, that it is normal for people to be abandoned by their parents, that it is normal for me to experience physical abuse or emotional abuse or sexual abuse and these other kinds of things. And what we all know here and why we're all here today is that we know in fact that it is not normal. But we have to message and course correct in a way that says to that person, you know, we talk about interrupting that intergenerational legacy of some of these kind of things. When we address adverse childhood experiences, that's exactly what we're doing. So we say, you know what, I'm sorry that that happened. We were talking about suicide a few moments ago. Let's talk about the pain that that person must have been in. Let's talk about what you can do. One, take care of yourself as you're mourning the loss of this individual, but also what you can do should you experience some pain. You know, when somebody says that, you know, it's normal to be called out my name or have somebody put their hands on me, like, no, it's actually not normal. Let me support you having some validating, supportive experiences that affirm who you are and your worth as a human being, that those become the important things that we want to do. Now, here's the thing, that the adverse childhood experiences are so prevalent that we sometimes miss it. The murder, the public execution, I said that wrong. The public execution of George Floyd was an adverse childhood experience that every child in these United States of America and beyond was exposed to. And the repeated showing of his assassination kind of etched in their mind. And then even as we think about today that they're dealing with what appears to be another assassination of a Black man that's shown on TV. Because what happens is when you show these things on TV and when it kind of keeps getting repeated and repeated and repeated, you start to say, oh, okay, this is kind of how it goes. This is, you know, but it's not. We have to treat that as an adverse childhood experience. We have to help our young people understand what that means. And we have to limit their exposure to that type of media. COVID was an adverse childhood experience in that it disrupted everybody's life. Kids missed graduations, they missed extracurriculars, they missed school, their parents lost jobs, they had family members who died from COVID. Again, that's an adverse childhood experience. And so, again, having the adverse childhood experience in of itself is not the problem. Supporting, intervening with the young person and the community of young people that says, hey, let's talk about what happened. Let's talk about your feelings. To your point, Shanti, that you always, let's normalize help seeking, and let's destigmatize any shame that's associated with that. That when we begin to create those opportunities, provide those resources, that what we happen then is we can go back up this way. Because otherwise we just get a lot of background noise that can disrupt development, which then disrupts achievement in school, disrupts peer relationships, adult relationships, etc.
100%. And thank you for that, Dr. Reese. It's so much that our children are experiencing right now. And you talked about watching those images, on television, and so many of them are on social media, and seeing those videos over and over and over, the 5 seconds of someone getting shot or anything violent. It's like you're re-traumatizing yourself in the brain. And it's hard for some of our kids to come out of that. And yeah, it's just a lot. We can do it, but it's going to take the village, and all the folks that are panelists on this call and these great organizations. That's why we're grateful to have you on here tonight, because it really is a collective effort amongst the community, schools, partner organizations, parents, and so forth. And we do, someone said earlier about talking to the parents, I think it was Takesha, we do have to train our parents, because that word stigma is still there. And a lot of our parents want to think there's nothing wrong with my child. My child, no, they don't want to talk mental health in some of the households. And so, that's bringing me actually to our next question. And I'd like to go to Brandon next. As we mentioned, yesterday was Black Children's Mental Health Awareness Day in the state of Georgia. And part of recognizing the day is also working to reduce stigma that surrounds suicide and mental illness. Brandon, can you talk a little bit about the stigma associated with mental health in the Black households and the effect of this on the child and adolescents around mental health?
Yeah, absolutely. And I'm glad that we're talking about this and bringing this up. I think, the issue of stigma is a complex one. I think initially, especially when we're talking about suicide among our kids, I think one big point, to mention is that for a long time, suicide wasn't seen as something that happened in our community, right? Like suicide was, something that was not an issue, particularly in our community, like that happened in white communities, with white children. Like we didn't necessarily, attach suicide to a lot of the things that we experienced in our behaviors. And so as we had young people, and our young people started to talk about, suicide, have suicidal ideations, and, there were attempts and even deaths by suicide in our community, it made families feel shameful, right? Like they didn't feel, they felt like, my goodness, like this happened in our family, like our community, like there has to be the first one in our community. Like we haven't heard other people talk about this. And that feeling made it really, stigmatized and isolating for a family, because we didn't talk about it and because it wasn't seen as something that happened in our communities. A lot of families, when it did happen or they had a child with suicidal ideations, it wasn't something that was really talked about. And, even just the issue of, mental health and suicide, especially, in some of our communities and connected to our faith-based organizations, faith has been a big part of our community for so long. And so even having suicidal thoughts was seen as a lack of faith, right? It was seen as, this is something you got to pray out. Like, you got to go to, your faith leader to pray out. And so it wasn't necessarily seen as, something that really happened in our community. But what we know now is that this has been going on for quite some time. Like we've seen a twofold increase in suicide deaths nationally between Black kids between the ages of 5 and 12. Like that's a crazy statistic, right? And it's, 2 times as high as white youth in that same age bracket, right? Like that statistic never gets easier for me to say. And so, knowing that this is, that this is an issue and seeing this, I think even still another point of it with the stigma piece is that, Even for those family members and those people who went to mental health services, they weren't always safe for us. Like, they weren't always a safe space. We weren't always able to find a Black therapist or a Black counselor or a Black psychologist, psychiatrist. Even now, for Black psychiatrists and psychologists, we make up less than 2% of that whole population, right? And so, and many of our therapists and counselors are waitlisted. So, it's been a difficult thing. And I think now to start to engage in these conversations around, suicide in our community and with our young people is to start doing things like tonight and opening up these conversations, letting people know where resources are and how to find a Black therapist, how to find a Black counselor, how to get connected to community-based organizations such as your own that's really making a change in the community around this topic, I think is really, really important. And, having, before, some of our generations before us, there were so many, things that they were battling, so, for civil rights and equal rights and things like that. Mental health wasn't necessarily a thing that they could focus on at that time, right? There were so many other traumas and things that they were trying to get to in those points. And I think now, as we've, understood that this is, an important topic, I think just bringing everybody back into the conversation, letting people know where resources are, making the job of trying to find mental health resources easier for people, I think is another thing as well. It could be overwhelming trying to find a therapist and a counselor. So I think there are a lot of things that kind of, contributed to, the stigma the way it is. And I think the more we have conversations and, normalize this, and this can be a heavy topic to talk about, but the more we talk about it and understand that our young people need to have these conversations, I think the better position we can put our communities.
Thank you, 100%. And that is something that we are working hard to do, particularly in our community. Brandon, yesterday was really special. We had our second Silence is Shame Sunday dinner. We started this new program and initiative because we know what the Sunday dinner has meant and still means to our community. And so, we got some parents together with their teens and we talked about mental health over some fried chicken and green beans and Brussels sprouts and mashed potatoes. But we had, some hard conversations, and it ended up being such an emotional night of healing and unpacking some of those layers. And so, we have to do more of that. And we look forward to collaborating and finding more ways that we can continue to start these conversations in new ways, right? That's not so hard and a little bit more palatable for parents and for folks to take in. I'd like to hear from you next, Brittany. In 2018, Voices for Georgia's Children reported that nearly 80,000 middle and high school students reported having seriously considered attempting suicide. At such an alarming rate, there's a need for a variety of mental health programs for youth and adolescents. How do you think we can increase access and visibility of mental health resources for this particular age group?
Absolutely. I'll start with the access piece. And one of the most effective ways to increase access to mental health services is placing them where our young people are spending most of their time. So that's schools. Georgia has a school-based mental health program called Georgia Apex program, and is currently serving over 700 schools. Now, that doesn't cover all of our schools. That's 700 out of 2,200 schools. But other schools have school-based mental health programs too that might not be classified as Georgia Apex. So I would start there. Start by contacting the school counselor, school social worker, or even teachers to find out what's available at the school. And I say teachers because they're usually the first to notice like behavior changes that might be indicative of some type of mental health challenges. Also, consider reaching out to community service boards because they have a charge to serve young people and families, and they can be really helpful in connecting you to local resources. I do want to mention one thing about the Georgia Apex program. Persistent advocacy is really needed to continue expanding the program. And part of that advocacy is being relentless in sharing your experiences, your barriers, and seeking mental health services. Part of the work that we do at Voices is really lifting up those experiences and identifying policy solutions to really help address some of those challenges. But I do recognize that that's a long game strategy. So for immediate needs, We have the MyGCal number, which is a 24/7 hotline where they'll immediately connect you to mental health resources in your area. They actually recently created a text line. So that way, for a young person who might not be totally comfortable with having that type of conversation, they can text that number and be connected to resources. There's also an app called Not Okay, and this app will allow a user to push one button and they will route resources to you either through text, a phone call, using your GPS location, and send out a mental health provider to you. Now, as far as increasing visibility, we really can't overstate the power of social media. Leveraging social media to share these resources not only helps reduce stigma, but it also increases the reach. For example, we have a Free Your Feels campaign going on right now, which is a statewide youth mental health campaign that really encourages speaking out loud, expressing your real feelings, encouraging adults and peers to check in with each other, as well as listen judgment-free. And then it connects everyone to resources for additional guidance and help. And then the last two things that I'll mention as far as visibility, really seeking out opportunities to co-brand with organizations, entities, brands, celebrities that the age group really cares about. Silence the Shame, I think, is doing a great job with this because I've seen where you've partnered with the Atlanta Hawks for different events, and that's a great example of doing that. And then lastly, just in my work, I've been facilitating some youth mental health groups, and I've found that engaging youth is really key. Like, we really want to incorporate them in this conversation. Many teens are looking for opportunities to learn from their peers, as well as engage in youth-led advocacy, and are more than willing to share from their experience or their perspective ways to increase access and visibility to mental health resources.
Those are all great resources. Thank you, Brittany. And it's an honor for us to be a part of the Free Your Feels. You guys are doing an amazing job with that campaign as well. So thank you for the work that you do. Would anyone else like to chime in before we go to the next question on how we can increase access and visibility? Dr. Reese, I think you want to share something.
Yeah, just real briefly. So one, I appreciate Brittany's thoughts in terms of kind of being creative and creating groundswell around making access to resources more possible. The other thing that I think we have to do is that we have to make this a policy issue. In the state of Georgia, part of the reason that there are 85,000 people who wanted services and couldn't identify is that the providers are not out there. And so that when we talk about the availability of pediatric psychiatrists, pediatric psychologists, or other folks trained to work with kids, they're just not available. And issues of access have always been more challenging for African Americans than they have for other demographic groups. And so when there has been a stigma that we're working hard to kind of dissolve in terms of the mental health piece, and then you're looking for somebody who looks like you, that you might feel more willing to kind of go see, those folks are not available. And so that one of the things is tell your state senator, your state rep, your Reverend Warnock, John Ossoff, these other folks, that we really have to do a better job. They recently signed the Mental Health Parity Act here in Georgia to kind of lift it up in terms of, but the thing with the Mental Health Parity Act is you have to have insurance. And so that one of the things that we also know is that a number of people don't have a primary medical home because they don't have insurance. And so there's work for us as adults to be doing in terms of putting this issue in the ears of those people who can create change around those kinds of things. And to Brittany's comments about talking about your experience, one of the things I think is important is that even if somebody is available, doesn't mean that's the person that should be working with your child. So make sure that we're being a good steward of who we are trusting the spirit and soul of our kids with as they try to better manage this thing called life.
Thank you, Dr. Reese. Trebor, did you want to mention something?
I do want to mention something. I may be jumping ahead, but one of the questions we've already gotten is, again, talking about silencing that shame, erasing that stigma in the Black community. If that's something I need to hold on to, but I'm just chomping at the bit. I read that, and I think that's part of what this forum is about. So if it's an appropriate time, I'll go ahead. If not, I'll wait.
Sure, go right ahead. We definitely, whatever you can add to help us keep normalizing it and silencing that shame.
So again, in terms of our panelists, many of the people who have probably joined us, a lot of us get it, right? What we're trying to attack, what we're up against, that stigma, that shame in the Black community. I not only speak as someone who had the unfortunate task of looking over these babies when they end up in our morgue and tell you that, yes, they are Black. I'll tell you something else. They're boys. I'll tell you something else. They're girls. I will tell you that our Black children are hanging themselves. These are those conversations that people tell me that, well, Trebor, you're the gloom and doom in the room. People are not ready for it. I need for us to get ready for it because this was my life for 7 years. They're hanging themselves. They have access to firearms. You all know that this is I don't get into politics, but we're a guns everywhere state. So certainly our children have access to those lethal means. I'll share with you really quickly one of the cases that I personally got involved with, this mother, because she wanted to advocate for other parents when it came to this very topic. Let me just give you the scenario. We have a 13-year-old little Black boy who comes from a 2-parent household. So let's throw out some things at you that we're going to say, well, that's different. Not a troubled youth. He's a good kid. They live in Fayetteville, Georgia, Fayette County, Georgia. Nice home, good parents, good school. Not only was he Black, not only was he a boy, he was being bullied by mean girls. So let's talk about getting outside of what our parents, we've already talked about clergy, our religious family, our family members. We're way outside of what we believe when it comes to suicide. It's not a Black problem, right? Don't get me wrong, statistically speaking, across the country, white males are still #1 in terms of the highest number of suicide rates for children and adults. But let's talk about this little Black boy. He was going to school and he was having a problem with mean girls in his school. Now, normally when you talk about bullying scenarios and dealing with girls, they're harassing other girls. He was being harassed at school. His mother found out about all of this much too late. So now I'm speaking to parents. I'm appealing to them to listen to this scenario. He was having some trouble at school. Some of the teachers, coaches knew that these girls were causing him a problem. He came home from school one day. They had a policy of putting the phones in one area when they got home from school so that they could sit down and have dinner together. Already, this family is doing much more than me and my household. I wish I could get everybody to sit down for dinner and put the phones away, right? So again, they get those check marks for not being the norm of what we expect with a child who has completed suicide. The only thing different about this young man that day was he said, "Mom, can I keep my phone for just a few minutes while I go get cleaned up ready for dinner? I'll put it right back." She said, yes. She called him about 15 minutes later and told him, come on up front. It was time for dinner to do their routine. He didn't come. She called him again. Like I said, he was a very good boy. He always listened to his parents. They didn't have any problems with him. He didn't come. She knew that was unusual. She went to his room. He had hung himself in his closet. And the irony of it, he had used a lanyard from a mental health conference she had attended. The irony. They did not find out until 2 days later when they played voicemails from his cell phone that he was being harassed and antagonized by these young ladies at the school. It was well known. And again, nobody did anything about it. So when I go back to, not only am I saying, imploring to our families, our parents here in the Black community and those who give them guidance and counsel, these are our kids whose perception is their reality. They hurt like any other child and they have issues and they don't know how to necessarily deal with those issues. A few days further after his funeral, children from the school and the community flooded her house with their expressions for her, expressing their concern for her and they're just sorry for her loss. And when she brought me these drawings from all of these children, several of them said, "I'm sorry for what you were going through." So once again, when I say wake up to our parents, wake up to our our caregivers, our educators, these children talk amongst themselves, right? They don't necessarily come to us and say, hey, I'm having these problems. A lot of times we expect our kids to get over it, right? Anybody that has any daughters, right? You raise a teenage daughter and you say, wow, that's that drama queen, and you think she's going through a rough patch. I will tell you that she might be going through a rough patch, but she may also be contemplating the unthinkable. So for my parents out there listening, we don't want this to happen to you. It can happen to you, and it's happened to 50, 60 parents on average a year in the state of Georgia. About 20 to 25 of those on average are going to be children of color. Take the lethal means out of the house. That means if you have a youth who may struggle with anything, don't give them the tools that they need for this to happen. Again, there was nothing that mother could have done, but we found out the prevention piece came as it was related to the school and what they saw going on, and it went unaddressed.
Thank you. If you want to quickly add to that, Brandon, before we go to the next question.
Yeah, just really quick. And I appreciate you, Ms. Randall, for putting that out there. Like that's a heavy story, but it's the reality of the situation. I definitely wanted to, piggyback off of what Brittany said when she was talking about, youth voice. I think we really need more young people at the table, like when we're thinking about developing resources and figuring out what these issues are, because from the story that Ms. Randall laid out, our young people see what's happening. Like they know that they have conversations about this, they experience this. And what I tell parents often is that young people are not unfamiliar with the conversation around suicide, around mental health, around, depression and anxiety. Our young people are talking about it, right? Like they understand what those things are. And I think the more we have them, at the table. At ACOMA, we started something called Team ACOMA, where we have a team of young people, that works as an advisory group to help us, identify what we should be doing. But the more we can have young people within these conversations to talk about what they're experiencing, we can realize that there are some things that they are used to, that they experience, some of those, adverse childhood experiences that Dr. Reese talked about. Like they understand it and they know what helps, right? If we can pull them to the table and kind of make sure that the youth voice, that they're being heard and that their thoughts are being considered as we try to figure this out.
Thank you.
And I will add to the end of Brandon, Ms. Shanti, I'm sorry, they're getting younger and younger. 10 years old, our last state fatality report that's been published, it started as young as 10. And people will ask me, Agent Randall, does a 10-year-old really understand the permanency of suicide? And I'm here to tell you that they do. They research it, they make a plan, and in their minds, it's the only way.
Thank you for that statistic. I even heard of a 6-year-old, quite honestly. I'm not sure if it was the state of Georgia, but it's quite troubling. And to both of you all's point, we do need to include, teens and young adults and adolescents into the conversation, because they, we're the aunties and the parents and the old folk in the room, if you will, and they'll clam up around us. But like you said, they'll talk amongst one another and we'll think we're doing the right things, right? I don't have children, but I'm an auntie of 6, and it gets tough for them to open up. So that is something definitely as a takeaway, I think, for all of our organizations, for schools and nonprofits and so forth, is to continue to make sure we bring them into the fold so they normalize this conversation with us. I want to go to you next, to Keisha. We have about 10 minutes left before we open up for Q&A. And I want to make sure we can get through these next round of like 3 or 4 questions. So Takesha, mental health problems in children can manifest differently than the common ways we see in adults, such as outbursts, academic concerns, and outward expressions, and lead to children being labeled as bad or difficult. And we know those can be as a result, of the adverse childhood experiences. How can we address these issues and reshape support in schools and other settings so that instead of just sending a child to detention, and sometimes they may need it, but sometimes it's other stuff going on, right? And they're just quickly labeled as a bad child. What can we do?
Thank you. Great question. I think definitely one thing that is key is to establish those meaningful relationships in our schools with our students. We speak about every child having a champion, and definitely whether that be the teacher, whether it be the principal, whether it be the janitor, but definitely being able to have that connection in the school to where a student actually feels comfortable, and to also be mindful of those signs and understand that they are a result of something, possibly whether it is a, adverse childhood experience, or anything that that child has gone through, but definitely paying attention to students who may even become withdrawn, so the outward bursts and the outward expressions are things that we can see, but definitely observing the student, if they are flat, if they have a lack of interest, or even a lack of response to events that normally would trigger someone. Dr. Laroy spoke about some children having begun to see violence as a normal part of life, meaning that they could possibly have no response or have no feelings for in response to events that we identify as being traumatic. So we definitely need to identify those and identify those students, and also being able to train our professionals, our teachers. Our teachers are trained in education, and not so much in addressing mental health and identifying those things, but educating our stakeholders, educating our teachers to be able to identify that. I will say that from some data that we collected here in my district pre-pandemic, we saw that over 50% of our students reported that there was a lack of being able to self-regulate their emotions. So, which means that they feel that they themselves don't have the capacity to respond or cope when they are being triggered. So this speaks to an increase in impulsive behaviors, but it also speaks for the need for educational professionals to be able to identify these behaviors and be able to address them. A lot of our teachers or a lot of our professionals may not know how to address it, but definitely being able to begin these conversations and allow them to identify and train them on how to respond, who they may need to refer that student to is definitely important. Another major indicator or something that I think can be done that is often ignored, and we have touched on it some, but just be mindful of the words that our own children speak. Our children talk to us all the time, and we say all the time, out of the mouths of babes. That's a phrase that we like to use in our communities when our children speak passionately about something that they are feeling. And this holds true when they speak about their own feelings. Our children are the experts on how they feel. And they definitely, as you all have mentioned previously, are able to speak about how they are feeling. And we definitely want to create a safe space for them to be able to do that and not allow our students or our children to feel that they are left unheard. So I just charge everyone to please trust your children, trust our children in our community when they speak about their feelings and emotions. These conversations are so important, and to continue to have them softens the stigma that is oftentimes placed on children when they exhibit, particular behaviors, as you said, and could prevent them from being labeled. It's so important for us to be able to identify these factors so that the appropriate support can be offered to our children and to our families in an effort to be able to support them where they are and realize that they may be in a different space. They're not going to progress on our own time. Everything is personalized and nothing is cookie cutter. So we want to encourage them to not be afraid to seek assistance from their community and not be afraid to speak to those who are servicing them. So I think one of the main things or the main takeaways is to listen to our children and listen to what they're saying, listen to what they're feeling so that we can then respond to what their needs are.
Absolutely. Thank you, Takesha. They just want to be heard, right? And we were all teens and kids at one time. And I really will caution parents, right? Because we're kind of still in the pandemic, but coming out of it, and we're starting to go back to normal and in-person events. And what I don't want us to do, right, as families and communities is go back to rush, just blowing people off and talking fast past our kids and not listening to them. Because if we fall back into that rut of our everyday schedule and we're so busy and we don't have the time to do it, we got to make the time. And to your point, we have to listen to our kids. A couple quick questions before we start Q&A. Dr. Reese, I'd like to go back to you. Mental Health America found in 2015 that an estimated number of 85,000 Georgia children have a mental health need. And that was in 2015. So imagine what those numbers are now, but are not receiving treatment. What factors contribute to the lack of treatment and how can we combat this?
Great question. I think that there were some important insights shared a little bit earlier that provide some illumination on this. But the 10,000 foot answer to this is that there's no infrastructure. There's been a lack of investment in infrastructure in pediatric behavioral health in the state of Georgia. Those resources don't exist. One of my colleagues was talking about the APEX program a little bit earlier, and how they have 700 schools that are involved in that program now. And that's just a drop in the bucket. And the program can't meet the scope of needs that these young people have. So part of it is we have not planned well for it. I mean, Georgia is a state that ranks close to last, both in adult and pediatric mental health services in terms of both quality, access, and certainly around the cultural competence piece. And so, my earlier comments about how we use our votes and how we pick up the phone and talk to our elected officials becomes very important here. Because, the points that have been made about suicide prevention, the points that have been made about how we understand the young person who may have some challenges is how do we support that person that comes to our attention? When person X has a 3-month waiting list, but that's who you would want your child to go to. The person P over here might see your kid in 2 or 3 weeks, but you know what? There's a reason that they have availability. And the fact that they have availability probably means that you might not want your kid to go see that individual. And so one of the things so we have a problem that we need to address. I mean, this is adult work here where we listen to Takesha's earlier point to our young people who are saying, hey, we have these needs. And the brother talked about kind of the Council of Young People and how Coleman kind of takes their cue from them on some things. So if we listen to young people and them telling us what we need, the adults then have to build these systems that can respond to the needs that our young folks have. But the other thing that we can do, because everybody's not going to see somebody like me, they don't need to see a Dr. Reese. We need to be also thinking about how in our churches, how in our schools, how in the youth serving organizations that our young people have contact with, that they're promoting positive mental hygiene, right? So that those life-giving skills, that thing we call pro-social competence, that they have opportunities to develop those kinds of things at Boys and Girls Clubs or at Scouts or at the YMCA, because part of responding to the need, like if we had those preventative strategies or health promoting resources in place, that need might get cut in half. And then we could focus on how we support those other people who really do need to get in front of a psychiatrist or psychologist for some support. But I think this is I'm looking for your day at the Capitol where we have special conversations with the governor.
Absolutely. Thank you. That's actually leading us right into our next and final question before we go into Q&A. Trebor, can you talk a little bit about the importance of recognizing days like Black Children's Mental Health Awareness Day, and not just in Georgia, but nationwide? And we certainly at Silence to Shame, we're going to do our part to do other states and then hopefully take this thing federal with the help of organizations like folks that are on the call.
I mean, I think it's critical. Kudos again, like I said, the work that Silence the Shame, Georgia Voices, all these different organizations do to advocate for children, but especially minority children, children of color. Like you said, there's an issue nationwide, but obviously my heart is near and dear here in Georgia, where I've had to stand over those children who had been failed. I'll throw this out there to, further wake people up and say, well, I think that's a strong statement. We believe that a suicide of a young person is always going to be preventable. The cases that I unfortunately looked at day after day, they were preventable. There was something that could have been done that would have produced a different outcome for that child. When we talk about, having our day at the Capitol or having a day of recognition, I think that does speak volumes because it means that someone's listening. And then for someone who's paying attention, they may say, maybe I should take a closer look. My child has been struggling. Maybe, I shouldn't listen to, and my mom would kill me for this. I grew up in that church family where you prayed about everything and you sought counsel outside of the church for little of nothing. Well, that has caused some serious issues. They have raised us, and now we're raising children who think that it's shameful to say, hey, I need help, I'm struggling. And as a result of that, they do not know how to cope with disappointment. They do not know how to cope with, he already talked about the ACEs, and thank you for explaining to everybody what that is, because we all have them. We know going through a pandemic was very hard on our children, let alone those children who are already suffering. We left those kids at home without that safety net. Some of those kids didn't need to be in those homes. Going to school for 8 hours or however many hours a day was a safety net for them. So they were subjected to even more abuse, whether it was mental or physical. So again, my hope is that bringing these issues to the forefront, let's get politically involved. We love to talk about Georgia being #1 in business and other things, but Georgia is last when it comes to, maternal mortality and infant mortality, and when it comes to healthcare, when it comes to education. And you notice a common theme there. I'm talking about our children. I care a lot more about our children, and I think they should come first. So as I mentioned, me being rewired or retired, I'm a little bit unbridled, but I think that we need to have these tough conversations with those who want to lead us when it comes to our children and our children of color, who are always disproportionately affected by these things we're talking about, such as mental health.
Thank you, Trebor. Yes, it is election time. We're gonna, hold their feet to the fire and get out there and call your elected officials or the folks running, and let's have those tough conversations. Thank you so much, Trebor, and thank you to the panelists. We could talk all night, but I do want to make sure that we allow our viewers to be a part of this great community conversation that we're having on behalf of Black Children's Mental Health Awareness Day. So I'm going to jump right into some of our questions. The first one I'd like to read is, for the past few weeks, it's an anonymous question. My son, who is 11, has been having suicidal thoughts and is having a hard time in school socially, but not academically. He starts to have thoughts at school and rarely wants to go. What are your thoughts about inpatient behavioral hospitals? I've spoken to him about going and he is not against it, but I'm not sure. I am scared. Who would like to take that? Dr. Laroy, would you like to take a stab at it first, or anyone that has thoughts on that?
No, actually, I'll take a first cut at it.
Okay.
So their son is 11, so that's either a 5th grader or a 6th grader, and middle school is hard. And so one of the things, here's the kid, sounds like they're doing well academically, but struggling getting plugged in and finding their place in space socially. So a couple things. One, I would get the young man in front of somebody who can help unpack what's the level of threat or risk to the child. And one of the things I'm telling parents right now is that if you can't get in with a behavioral health provider, then Brittany shares some great resources in terms of crisis intervention. But if you can't get in with a mental health provider right now, that one of the things that you might want to do is start with your pediatrician, in terms of that's somebody that the child probably already has a relationship with and can broach that conversation like, hey, what's going on? Let's figure out how we create a win for you going forward. Because the other thing is, mom is contemplating inpatient hospitalization. that's not a foregone conclusion. So you could present at an emergency department, say, hey, we want to check out an inpatient placement, and here your child's not appropriate for an inpatient placement. And they might start to then talking about outpatient work or intensive outpatient work or those kinds of things. But mom is asking the right questions. She's saying, there's something happening with my kid. I'm not sure, and I need some help. And so my first step would be to have her talk to the pediatrician, get an emergency appointment there, and then evaluate the options. The other piece would be to talk to the school counselor to see if anything has come to the counselor's attention, to kind of help provide some understanding for what the student is dealing with. And it's awesome to hear that the young man is not opposed to intervention or support. That's the thing that allows us to have a positive prognosis for him.
Thank you. Did anyone want to quickly add to that before we go to our next question? I love that though, Dr. Reese. You gotta have the right questions to ask. I think that might be one of our next pamphlets we hand out. What questions do parents need to ask, and how do they evaluate that with their doctors? Anybody else?
Shanti, I would just like to say kudos to mom for even asking that question, because a lot of parents do not know what to do. They don't know where to go. I worked with a pediatrician on our last PSA, and he was very candid in saying, I'm a pediatrician. I'm not equipped to handle mental health issues of children, but that's what I'm doing every single day. So the fact that she's reaching out, we have the text lines, we have the chat lines, but definitely start with a doctor, a physician, a counselor at school, as he mentioned, because they're supposed to be able to then in turn refer you to the appropriate resource. If he has made an outcry, I will tell you, Mom, that there is an urgency.
Thank you. Thank you, Trebor. Okay, our next question. This is directed to you, Brandon. Do you think there is still a sense of shame when we discuss suicide in the Black community? What are some ways we can open the conversation up to our elders and our peers who might not see this as an issue in our community?
Yeah, that's a great question. I mean, I think it's definitely a layered one, but I think, yes, definitely there is still a shame, connected to suicide in our community. And I think also, the thing that it also is connected to is that for so long we've, society and, has looked at us as this, these tropes of, strong Black women and, strong Black men that we're supposed to, we've, gotten through so much in our history that we're supposed to be able to get through anything, right? Like, especially with so many of the outward things that we've, combated, that we're supposed to be able to handle, anything, especially if it's internal, right? If we're supposed to be able to get through some of those things. So I think there is shame. I think people, I know the person mentioned elders in particular, may just not see it as, as an issue, or as mental health being as strong as an issue, just because, there may be some things of, how they were brought up about, that there's bigger things to worry about, like there's other things to be concerned with. And so I definitely think that there's some, shame. And I think for parents, it's hard when, I'm a dad. So I'm a dad of two. I have a 10-year-old son and an 8-year-old daughter. And, a lot of parents, like, what you want to do is that you want to set your kid up with everything, that you didn't have, those things that you feel are great for them. And so if you are hearing, that your child, maybe having suicidal thoughts, I think sometimes for parents, it feels like, where did I mess up? Like, where did I go wrong? What am I not doing? What am I not saying? What am I not asking? What am I not giving them? And I think it kind of creates that, that shame in that sense. And so I think in terms of engaging this conversation, I think particularly with our elders, there are so many things that we have gotten through, but we've never gotten through them without community. We've never gotten through them without supports. We've never gotten through them without the village, without the collective, right? Like, that's what we use to kind of get through these things. And issues around suicide and mental health are no different. We need each other. We need community supports. We need mental health supports. We need those things to, be our complete selves, right? Like, we're made up of our physical, our mental, spiritual and other things. And so if we're not actively working on all of these things together, one of the things can fall to the wayside, and then it can kind of mess up everything else. And so I definitely tell people as we create communities, whether it's conversations, whether it's supports, whether it's community-based resources, whether it's national resources, for us, this is another thing that we are trying to get through, and we can get through it. And we've gotten through many of these things, in the past. But again, it takes community and it takes village to do that. And it starts with conversation. And so that's how I've, approached this with, some of our elders and getting into it. And again, it takes time. So, people may not just, instantly, hear, an issue around suicide or mental health and immediately know how to jump in. And so I think patience is important also, and letting people know that, if you're dealing with someone who may be older, who may be experiencing some of these things, just try to be a safe place to land, right? And I say this with our young people too, they may not want to talk to you today about it. Today may not be the time. Today may not be the place that they're in their best selves to talk about it, but it may be a week from now. It may be a month from now. So continuing to let them know, if it's not today, whenever it is, I'm here for you. I can listen. I can't remember who said it, but someone mentioned like listening without judgment, right? And, with our young people, if they're coming to you about an issue around, relationships are big for our teenagers, and, letting them know, like, for us, it's like, you may not remember that person 10 years from now and all this other stuff, but if we put ourselves into when we were younger, we know how those things felt. So just listening without judgment, getting people a safe place to land, and just letting, our elders know that this is just another facet of our community.
Thank you. I think that was a great response. I appreciate that. We have another question. I don't know, maybe Brittany or Taikisha, if you want to take this one, or Dr. Reese. I have noticed since the pandemic began, my 11-year-old daughter has been sneaking food and gaining weight. Could that be her way of dealing with anxiety or her comforting herself? Would anybody like to take that? We can go back to our clinician, Dr. Reese.
Yeah, so I think the mom is spot on. I mean, anybody who survived the 2 years of the pandemic and hasn't been negatively affected in some way is a unicorn. All of us, all the people on this panel, all the people in the audience, all of our kids, everybody has been impacted by the pandemic in one way or another. Now, as to the question of whether her sneaking food is to comfort her or is how she's coping, that's an empirical question and really involves, and we've talked about the use of listening kind of throughout today's panel, but really spending some time listening, like, one, why are you sneaking? And two, all behavior serves a function. And so mom is really asking, what function does sneaking food at night serve for the daughter? And once we understand the function of the behavior, we're then in a place to say, hey, are there more adaptive, healthier ways to deal with, to cope with whatever it is that's going on? I think the thing, kids do things that get our attention. So when you go in the room and you find food and this other kind of stuff, and you're not supposed to be eating it here, and you're paying attention, like, hey, I've noticed you put on a little bit of weight, etc. That's really telling us something's going on that we need to pay attention to. And the response is, hey, you've got my attention. Let's figure this out together. You don't have to figure it out alone. I can't figure it out alone. We're going to figure it out together, and then we're going to figure out what we want to do from there.
Thank you, Dr. Reese. I know certainly as an adult, I lost my mom in late January, and I had lost weight last year due to surgery, but I found myself eating my feelings. And so, I think we do that as children and adults, and sometimes it's a way of coping, right? And it ends up being an unhealthy coping mechanism. So thank you for that advice, Dr. Reese. Another really great question.
Can I chime in really quickly? Sorry,
yeah.
Shanti.
Sure.
I wanted to leave the formal response to our clinician, Dr. Reese, but I did want to chime in a bit on finding resources and just really lift up the value of community service boards in our counties, as well as family connections as far as seeking supports, for two reasons: that more than likely the resources are going to be close to you, with somewhere near your community, but then also just thinking back to the mom with the 11-year-old son. It sounds like connection is a major challenge for him, and they have access or resources to peer supports. So finding someone who is a certified peer support, as well as has that lived experience of what it's like to go through middle school and what it's like to be isolated currently and not too far removed from it. So I definitely wanted to lift up community service boards as well as certified peer supports. And I don't think this should replace seeking out your pediatrician, but it should be a both and. So definitely contact your pediatrician, but also look into those resources as well.
Thank you so much. And Trebor, I know you had another engagement this evening. If you do have to jump, we certainly appreciate your time, but we have about 4 more questions I'm going to try to get through, because I think this is such an important question, and I do want our viewers to feel like they are being heard, right? And this is a safe space. So let me jump right in. Is there such a thing as overstepping as a white teacher when introducing this conversation with Black students? If not, how would you suggest white teachers engaging in this conversation or introducing it? If so, how would white teachers overcome this? Who would like to take this question? Trebor?
I wouldn't mind addressing it just as I close as well. I appreciate her for even broaching the subject and having that boldness to say, how do I approach this? And my answer would be, you would approach it the same way you would approach this conversation with your students in general, letting them know that you care about them, that you want their voices to be heard, and that there is no shame, whether they can come to you one-on-one or whether you create that safe space in your classroom for kids to be able to talk about their feelings. If you have a particular child that you have a concern about, and that is a child of color, again, you have that right. You have that care and concern, obviously, or you wouldn't be asking the question to say, listen, this is a safe place. You can talk to me. If you're not comfortable talking with me, there are other people you can talk to this about. There is no need to be ashamed. Whatever it is you're going through, I acknowledge your reality. Again, we think that kids don't have any reason to be stressed out. I remember when I was young, parents would say, children don't have bills. I just don't understand. All they have to do is go to school, get their lesson done, but they have an enormous burden on them. Somebody mentioned earlier, just with school, let alone relationships and what could be going on at home. And I, again, will tell you, they do not have the coping skills. They don't have the bandwidth to deal with some of those issues that we did when we were younger, and I keep aging myself. So again, you would approach that and like you would any child that you may have a concern about, or your students in general, letting them know this is a safe space. I am a trusted adult that you can talk to.
Oh, sorry about that. I was on mute. Thank you, Trebor. Okay, next question. As a parent of a child with suicidal thoughts, how can I figure out if these thoughts are real or are they being manipulative? Who would like to take that question? Dr. Reese, you want to take a stab?
Yeah, I mean, if I could have an exchange with the person asking a question, I would ask the question first, what makes them think they're being manipulative, or what raises that question as a possibility? The tough thing about suicidal ideation and suicidal gesturing, ideation being a thought about suicide, gesturing, engaging in some risky behavior that could lead to suicide, is the overwhelming number of people who engage in some form of suicidal behavior actually don't want to die. They want the pain that they're experiencing to go away. They want the problems that they're facing to be resolved, etc. But the problem is, when you play with something that could result in your death, you could end up dead. And so for me, I take suicide seriously. You say you've got my full undivided attention, and I'm going to assess and evaluate whether you're a threat to yourself, and then I'm going to take actions that, if I determine that you are, to keep you safe to the extent that I can. And so I would encourage the parent asking this question to take a similar approach, because one of the things about suicide assessment in treatment is, and this is part of the prickly part of the work that we do sometimes, is that when we think somebody's a legitimate threat to themselves, you start losing choice. Now we recognize that we actually can't stop somebody from harming themselves if they're really committed to that, but there are things that we can do to create opportunities to observe, to intervene, to act, put in treatment strategies, to create safety plans, and these other kind of things. And so if the parent thinks, if the parent has this question, hey, is this legit or is this a manipulation? Let's find out. So let's get your child in front of somebody who can evaluate that very question. You get the expert professional guidance that you need to understand. Because if it's a manipulation, your child needs help. If it's not a manipulation, your child needs help. Either way, it sounds like the child needs help.
Thank you, Dr. Reese. And last question of the evening is, how do we hold our students to high expectations while also taking their whole person into consideration? I know we talk a lot about the whole child and education, right? And that whole thing. What are your thoughts around that? Anyone? Takesha,
I can
Brandon?
jump in really quickly. I think one of the things I would say to this is make sure that we're letting our young people know that their value isn't all tied into their achievements and what they accomplish and what they get done, and avoiding the conversation around perfectionism. And working with young people and connecting with them directly, one of the things that they have talked about is that they feel like they can't make a mistake. They feel like they can't, get something wrong at school, or, pull in a bad grade, or not, do as well on something. They feel like these expectations make them feel as if they have to be, perfect and flawless. And so I think letting them know that, if you make a mistake, like your worth, your value isn't connected, to that. We want you to be successful. We want you to get to these heights. And that's based on us knowing your potential. Like, we see what you're able to do. We know where you can go. And so we want to get you to that. But on the road there are going to be mistakes. There are going to be times where you can't, pull things off the way that you want to execute them, but allowing them to make those mistakes and understand that your worth, your value as a person and as a human is not just tied to that. And any thoughts, feelings, and emotions that come as a result of that is something that we can talk about and that we can explore.
Absolutely. And I think we touched on, I'm sorry, there was one last question. We touched on it a little bit, Trebor did. How can white people engage in this dialogue centered around Black suicide and mental health awareness in general? We know there are external barriers that people of color, especially Black people, face. So how can they show support, I'm assuming, and be allies, right, with this conversation and dialogue? Any final thoughts that anyone would like to share around that question?
I got 30 seconds here, and part of it will be to utilize whatever access and privilege that you do have in the interest of Black kids, in terms of making more resources available, sensitizing to the communities that you're a part of, and doing what you can to bring resources to the table in support of Black pediatric mental health.
Thank you, Dr. Reese. Well, our time, I think, has come to an end. This has been a wonderful, robust conversation. I see our incredible executive director back on the screen now. I would like to quickly go around and you guys just let us know how we can stay in touch with you, a quick Instagram handle or website or what have you, and any kind of like one line or one word on what we can do again to support Black children's mental health. We'll start with you, Takesha.
I would just charge everyone to use your village. We have a lot of, questions about teachers, and wanting to be able to be of support, and also want to be mindful of the stress that our teachers take on trying to pour into our students, because it is a lot. But definitely encourage everyone, even those that are providing services, to use your village. Your school is a village. Your community is a village. Please identify with some of your fellow coworkers in your schools who may have some relationships, who may even be aware of the student, their families, and may be able to help in supporting that student. We are all here to provide support to students and families. So I definitely want to charge all of my educators that are listening to please ignite your village in your school and in your communities to be able to best support the students while also fostering the relationships that you have with the students to make sure that they are whole, because they are one student, one person, and they are all individuals and have their own unique ways of doing things. So that is my closing words for tonight. Thank you so much.
Thank you, and thank you for being here. Brittany, closing words, and how can we reach you?
Well, I'll start with, you can reach us through Twitter at Georgia Voices. And then my final shameless plug would be, please, now is the time to engage in the policy conversation. Dr. Reese mentioned a lot how many of our pitfalls are related to infrastructure and the lack of provider availability. And one of the silver linings of COVID is that it's really expanded the palette of many of our decision makers in recognizing that mental health is a part of health. And, mental health, a lot of people were struggling with their mental health because of COVID and being in isolation. So now is the time to engage in that conversation. There are so many opportunities, like Dr. Reese mentioned, the Mental Health Parity Act passed. Some of the things that were included in that was to create a mechanism to really track the available behavioral health providers in our state. And families can get involved in that conversation and really influence whether or not that information is accessible to you. So now is the time. I can't say it enough. Please get involved in the policy conversations and let us know. And the last thing that I'll say is that we are currently engaging in focus groups. So if any of you are caregivers, parents, as well as youth, and wanting to get involved in those conversations and really let us know, what the landscape looks like as far as mental health in your community, there's an opportunity to do that as well. So I'll make sure I'll provide my email address if you're interested in that.
Thank you. Yeah, please put that in the chat. Brandon Johnson, the ACOMA Project. Final words, my brother.
Absolutely. I would say first, if you want to get connected to us, our website is acomaproject.org, AAKOMA project.org. You can find ACOMA Project just the same way across Twitter and Instagram. Definitely follow our executive director, Dr. Alfie Breland Noble. She's amazing. Her handle is Dr. So DRALAFLIEE. So Dr. Alfie. You can find her across social media. I think the final word is just for us to hold space for young people, for us to listen to what they're telling us and to believe what they're hearing and seeing, and for us to use that information to act. I think one of the best ways that we can show that we're listening to someone is change behavior. So if our young people are telling us these are some things that we should embark on, it's important for us and critical for us to incorporate what they're saying into the work that we're doing.
Awesome. Thank you. Last but not least, Dr. Reese, how can we reach you? Final words, 60 seconds or less.
Okay. So Shanti, I'm not coming on any more of your webinars without getting my social media situation together, because I'm lacking and it's broke. So
Send my niece your way.
So any interns out there that want to help a brother out, let me know. But I do have Twitter, so it's at Reese_speaks. And then I'll put my email in the chat as well. A lot of what needs to happen has been said. I think use your voice, vote, act with a sense of purpose, and share something that you learned today with somebody who's not been a part of this conversation. Invite them to the conversation. I think we have to create groundswell if we are to create safe places, healthy places for our babies to thrive. And I think if all of us do something, then something will happen great.
Awesome. Thank you. And I'm Shanti Das, your moderator. I'm going to turn it back over to Jewel Gooding.
Wonderful, wonderful conversation. Again, we cannot thank you all enough for being a part of this. We want to thank our guests, as well as our attendance members. I know this is an important conversation, and this is just the beginning. The idea is, one, this is something we need to talk about, and two, that we have those experts out there who can help guide us in the right direction. So just reaching out and figuring out what those next steps to be. And then most importantly, listen to your kids, right? I'm a mom as well, 3 boys, and I work every day to make sure that they can be advocating in their communities and feel confident in their mental health. But it's hard. This is a very difficult time. And these kids are surviving things that we've never had to. So also just keep in mind of making sure that you are protecting their mental health at all costs. And yes, our discussion is about Black children, but also all children is going to be what we engage with overall. We want to make sure that the attention is being brought up because we hear that, Black people don't die by suicide. They do. They attempt it many, many times, and we just don't ever talk about it. So now is the time that we are open, we're having those conversations, and that our students know that suicide does not have to be an option. And that we are making those conscious choices. So again, I want to thank you all for your time. And Katie is going to end us out with all of the great things that we're doing here at Silence to Shame and how you guys can stay connected and complete our evaluation. Katie?
All right. And again, to echo what everyone else has said, thank you for joining us. So today we did kick off our Silence the Shame week with this awesome discussion. We will be having a week full of engaging events starting tomorrow with our Healing in Public tweet-a-thon. We invite you to join us on Twitter at Silence the Shame and tweet with us and engage with us about your experiences. As well as on Wednesday, we will have a maternal mental health training. All of our registration information can be found on our social media at Silence the Shame. Most importantly, Thursday is National Silence the Shame Day. We are so excited to be heading to the gathering spot in Atlanta, Georgia. Meet us there from 12 to 5. We will have some fireside chats with Shanti Das, as well as Rory Reese from Netflix's Selling Sunset. We have a lot of great discussions that we're planning to have as we celebrate National Silence the Shame Day, as well as a follow-up Instagram Live on our social media, Instagram on Friday morning at 10 a.m. So lots of events happening. Follow us on social media to stay tuned with information, including registration. And of course, take time to self-care this week. Please be on the lookout for the email with the survey. It will also come up at the end of this discussion so that you can give us feedback so we can continue to have more great events like this. Thank you so very much and have a wonderful evening and a great week.
Thank you, everyone. Good night.
Thank you.
Thank you.